USMLE-style question on Factor V Leiden mutation. A 28-year-old woman presents to the emergency department with sudden onset unilateral leg swelling and pain. She has no significant past medical history, but reports that her father had a deep vein thrombosis DVT at age 40. She is a non-smoker and does not take any medications. She recently started oral contraceptive pills 2 months ago. Physical examination reveals a swollen, erythematous, and tender left calf. Doppler ultrasound confirms a proximal deep vein thrombosis. Laboratory tests show prothrombin time, PT, normal, activated partial thromboplastin time, aPTT, normal, D-dimer elevated, protein C and S levels, normal. Which of the following is the most likely underlying cause of this patient's condition? A. Antithrombin 3 deficiency. B. Protein C deficiency, protein S deficiency, Factor V Leiden mutation. E. Prothrombin gene mutation. D. Factor V Leiden mutation. This patient has a strong family history of venous thromboembolism, VTE, and unprovoked DVT at a young age, which suggests an inherited hypercoagulable disorder, thrombophilia. Factor V Leiden mutation is the most common inherited thrombophilia and results in a mutant Factor V, Arg506Gln, that is resistant to degradation by activated protein C. This leads to increased clot formation and a higher risk of DVT and pulmonary embolism, PE, especially in patients with additional risk factors like oral contraceptive use. Key features of Factor V Leiden mutation. Most common inherited hypercoagulability disorder, especially in Caucasians. Mutant Factor V, Arg506 resistant to degradation by activated protein C. Increased risk of DVT, PE, and pregnancy complications, recurrent miscarriage. Normal PT and aPTT, unlike other coagulation disorders, often asymptomatic until a provoking factor, e.g. OCPs, surgery, pregnancy. Why the other choices are incorrect? A. Antithrombin 3 deficiency. Can cause thrombosis but would show heparin resistance. aPTT fails to increase with heparin. B. Protein C deficiency leads to uncontrolled factor V activity but usually presents with warfarin-induced skin necrosis. C. Protein S deficiency leads to decreased protein C activation causing thrombosis but less common than Factor V Leiden. E. Prothrombin gene mutation also causes thrombophilia but is due to increased prothrombin levels, not resistance to protein C. Key takeaways. Mutant Factor V, Arg506Gln, resistant to degradation by protein C. Most common inherited thrombophilia. Increased risk of DVT-PE, especially with OCPs, pregnancy, or surgery. Normal PT. Diagnosis, activated protein C resistance test, confirmed with genetic testing. Treatment, anticoagulation, heparin, warfarin for symptomatic patients.